developing countries access their medicines from retail drug sellers, often from the most convenient source, which is usually the local retail drug outlet. Such shops typically constitute the largest group of recognized, although often unregulated outlets for non-prescription drugs in the country, and may be the only nearby place to buy medicines and get health advice on common illnesses.
The area is very remote. Most of the drug shops are located very deep in the villages.
Whereas these shops may provide the only option of access to medicines for the rural poor, they may also threaten people's health.
They were, of course, drug shops, and quite a number of them were being operated by non-qualified health workers, non-trained health workers. Actually, at times you found small businessmen getting into handling of medicine.
To ensure that quality medicines are available to patients in rural areas of Uganda, the Ministry of Health, through the National Drug Authority and in collaboration with Management Sciences for Health, as part of the East Africa Drug Seller Initiative, is implementing a private sector drug seller initiative in Uganda. The Accredited Drug Sellers Project in Uganda, ADS, has adapted the best practices that were used in Tanzania. The Accredited Drug Sellers Project was kicked off in Kibale on 12 November 2009. The project was officially launched by Honorable Stephen Malinga, the Minister of Health.
As a representative of the President and as a representative of the government of Uganda today, I would like to have the privilege, and I now officially launch the Accredited Drug Shop Program in the district of Kibale.
A number of activities were undertaken by the project to ensure that targeted goals and objectives are realized. In consultation with the implementing partners, the National Drug Authority, NDA, developed standards and regulations for premises, dispensing practices, record keeping, and personnel. NDA further established a list of prescription medicines that could be legally dispensed by accredited drug shops. Drug shop attendants received training on how to handle common medical problems, patient communications, referrals, and good dispensing practices. The training was conducted by the Pharmaceutical Society of Uganda. Social marketing and advocacy campaigns were used to raise consumer awareness of the need to buy medicines from qualified and reliable sources. The ADS project has empowered drug sellers to be able to advise, counsel, and professionally dispense drugs to patients. Measures have been put in place to ensure sustainability of project achievements.
What we didn't create any parallel systems. We worked with the existing systems. We made sure that the district was fully involved. We had the district people doing the support supervision. We had the ADS, the accredited drug shops, form an association as a private sector association. So they work hand in hand with the district health team to do self-policing and to do support supervision for themselves. So in a way we are seeing now the public and the private sector are working hand in hand to improve issues of access to medicine.
This project is a very good project. Actually, the patients, the health workers, and the community leaders appreciate the project and the improvement it has done in the availability of the essential medicines. And actually, I would request our government and our donors to implement the same project in other districts, especially the hard to reach and rural districts of Uganda.